Women's rights are being stripped, state by state. Since Roe v. Wade was overturned in June 2022, over a dozen states have passed total or near total abortion bans, even in cases of rape, incest, or when the mother's life is at risk. Georgia is one of those states. A fetal heartbeat, as early as 6 weeks, now legally defines a person, even if the pregnant woman dies, like Adriana Smith. Doctors are afraid to act, even in emergencies, because they fear legal consequences. Women are being denied life-saving care or forced to carry unviable pregnancies. 2. Black women are dying at alarming rates in healthcare. Black women in the U.S. are 3 to 4 times more likely to die from pregnancy-related causes than white women. The CDC and research institutions have confirmed that implicit bias in hospitals leads to Black women being ignored, dismissed, and undertreated. Cases like Amber Nicole Thurman, who died after a delayed abortion procedure in Georgia, and Tori Bowie, an Olympic athlete who died during childbirth, show how even wealth, fame, or status can't protect Black women. 3. States are trying to control women's bodies, even in death. In Adriana Smith's case, Georgia law forced a dead woman to be kept on life support because her fetus still had a heartbeat at 9 weeks. Her family had no say. She had no rights. In Texas, hospitals have forced women to carry non-viable pregnancies, knowing the baby will die, because abortion is banned, even for medical necessity. 4. Black bodies are still being used for testing and control. America has a long history of using Black people's bodies for experiments, from Henrietta Lacks, whose cells were taken without consent, to the Tuskegee syphilis study. Adriana Smith's case is chillingly familiar. A dead Black woman being kept on machines not for her, but to see if the fetus survives. That's not medicine, that's exploitation. 5. Women are being criminalized for miscarriages and abortions. In some states, women are being investigated, arrested, or threatened after miscarriages or suspected self-managed abortions. Even hospital staff have reported women to police, and some are charged with fetal homicide. 6. Poor women are being punished the hardest. Many of the strictest laws exist in southern states, where access to healthcare is already limited. If you don't have money to travel out of state or to private clinics, you're forced to carry pregnancies no matter the risk. 7. Mental health is being ignored. Pregnant women with mental health crises are often denied abortions, even when they are suicidal. Mothers who lose wanted pregnancies are being treated like criminals instead of being offered grief care or therapy. This is the real America right now, and your voice matters. You don't have to be a politician to speak truth. You don't have to be a celebrity. You just have to care. And you do. So, let's amplify this. Let's turn this into something powerful for our community. Would you like to focus on one of these stories next and build it into a feature for your platform? I can give you names, timelines, and real events, receipts from articles and official sources, emotional story layout that people will feel and share. Now, here's what you need to know about this deadly Georgia law and how it's playing out in real lives. Adriana Smith was 30 years old. At 6 weeks into her second pregnancy, she started bleeding heavily and feeling sick. Her boyfriend drove her to the hospital, Southside Hospital in Columbus, Georgia. She was admitted with an ultrasound showing a heartbeat, which under Georgia law meant she could not get an abortion even though she was only 9 weeks along. 6 days later, she died. Nobody told her family why she died. They just blamed it on her health issues. But her death certificate said heart failure due to pregnancy. It didn't make sense. Her family says she'd been healthy and active. Then her sister got a call from the hospital. The doctor told her they'd done everything they could, but there was nothing more they could do. They couldn't save Adriana, but they could save the baby. At the time, doctors said the baby was viable at 32 weeks. But by then, Adriana was brain dead and no one told the family. They didn't have the authority to make that decision. They weren't even told they could ask the courts to intervene. According to the doctor, Adriana was kept alive until 38 weeks so the baby could be born. For many, this might seem like a crazed, isolated incident, but this is just one example of what's happening across the South. At just 24, Tori Bowie was an elite track star, an Olympic gold medalist, and a new mother. On May 2nd, she was found unresponsive in her home in Florida after going into labor alone. Despite having a C-section less than 2 weeks prior, her obstetrician had assured her that she was fine to take care of her first child by herself. An autopsy revealed that Tori bled to death after giving birth to a stillborn baby boy. In a statement, her family expressed their heartbreak and suggested that if Tori had received the proper care and treatment, she would be alive today. Black mothers are 3 to 4 times more likely to die from pregnancy-related causes than white women, regardless of education, income, or health status. Research shows that implicit bias among hospital staff leads to Black women being ignored, dismissed, or undertreated. So even with a gold medal around her neck, Tori Bowie couldn't outrun America's healthcare system. Medical professionals are speaking out too. Dr. Stacy Woodard, an OB/GYN in Georgia, says, "We are mourning the loss of these patients and we are scared. We've always worried about losing a patient or two in our career, but to lose this many patients all at once to a political decision, that's hard to swallow. Hospitals are turning women away, even in emergencies. They're scared to treat anyone who might be pregnant." In North Carolina, New Hanover Regional Medical Center turned away a woman in active labor, saying they couldn't deliver a baby because they don't have pediatric care available. They sent her 2 hours away in an ambulance without pain management. Women are being forced to carry unwanted pregnancies to term, and they don't even know if their babies will survive. In Texas, 7 babies have died in utero from bacterial infections after being forced to remain in non-viable pregnancies. The law doesn't allow for abortion even if the mother's life is at risk. This means doctors are sometimes forced to choose between the lives of the mother and the baby. But it also means that if the mother wants an abortion, they must get creative, finding ways to obscure the truth from both the hospital and the law. A 25-year-old woman, Nikki, traveled from Texas to New York City to get an abortion. She was only 5 weeks along. What she didn't tell the clinic was that she'd been pregnant before, twice. Nikki lost her other pregnancies, once to miscarriage and once to a botched abortion in Texas. But she didn't want to go through a full-term pregnancy again. So, she took matters into her own hands. At the clinic, a nurse noticed that Nikki had severe cramping and excessive bleeding. After examining her, the nurse believed that Nikki had self-induced an abortion, which is illegal in New York, but also potentially life-threatening. When asked why she did it, Nikki responded, "I tried to take care of business myself because of my past, thinking I could handle it on my own." But she couldn't. The clinic called 911 and Nikki ended up in the hospital. And because the staff suspected she'd had an illegal abortion, she was arrested. In Ohio, a pregnant 10-year-old girl was raped by her stepfather. When she got an abortion, her doctor was mandated to report her, and he did. The authorities failed to investigate, and the doctor shared her personal information with the media. And across the country, a wave of misinformation is spreading. Rumor has it that Planned Parenthood is harvesting organs from aborted fetuses, but there's no evidence to back that up. Planned Parenthood has released detailed reports about their clinical procedures, but they've been attacked nonetheless. This fear-mongering helps distract from the fact that hundreds of thousands of people are being stripped of rights and bodily autonomy. As the battle rages on, women are stuck in the middle. Some are taking drastic measures, like stopping medication halfway through to avoid side effects. Others are getting abortions before they're actually needed. Doctors are terrified to follow these patients' wishes because if anything goes wrong, they could be prosecuted. What does the future hold? No one knows. But the truth is, women will find a way. They always do. And you can help us get the word out. Share this to spread awareness. Donate to support our independent journalism. And hey, don't forget, this is your channel. You can share your own story with us.